After a shocking news drop this morning, the San Antonio star player is set to miss the rest of the season with a blood clot in his right shoulder. In this video, we're going to talk about exactly what in the world is going on. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach you more about the medical side of the sports world. And today that means we're going to be talking about a condition called Paget-Schroeder disease. This is a fancy term for the name of when you get a blood clot, or specifically a deep vein thrombosis, DVT, in the veins in the shoulder. And specifically, this often happens in athletes who are doing a lot of repetitive overhead activity. We, of course, saw this happen with Brandon Ingram when he was with New Orleans, and of course made a full recovery and did just fine. So in no way is this in and of itself something that is career ending, but is very serious and can be a life-threatening thing if not discovered soon enough. So looking at the report from the Spurs here, announced that Victor Wembanyama diagnosed with a deep vein thrombosis, so that's a blood clot, in his right shoulder. Expected to miss the remainder of the season, and updates as appropriate. So to understand this, we really need to start with our anatomy model and walk through where exactly this blood clot occurs. So we're looking here at the muscle layers, and as we hide the muscle layers, we're going to see the key blood vessels that are important here in the neck. Now, we're going to hide some more through here to get a little bit better sense of things. And I want you to focus on specifically this blue blood vessel right here. This is going to be the subclavian vein. Sub, below, clavian, clavicle. So this is a large vein that is taking blood from the extremity, from the arm, and sending it back up into the heart to ultimately go into the superior vena cava, into the heart, pump to the lungs, get oxygen, and go back out to the arm through the, you guessed it, subclavian artery. Now, classically, a DVT, or a deep vein thrombosis, this Paget-Schroeder's disease, is when you have a blood clot either in this subclavian vein or in the axillary vein. So initially it's the subclavian, it then continues into the axillary vein as it gets down into the axilla. Most of the time it's going to be here in this subclavian vein. Similar to how you can get a blood clot in the leg, that blood clot can embolize, which means move, and if it moves, the next thing in line is going to be the heart, and then it can go to the lungs, so it can be deadly. Now, with prompt medical attention and treatment, this should not be deadly. The blood clot should be treated, resolved, and no emboli are going to get thrown or clots get thrown off to the heart. But this is great that they caught this, because this can be a challenging diagnosis. It's a very rare diagnosis, so absolute props to the Spurs medical staff for catching this before it caused any significant other complications. So then to treat it, what you basically have to do is usually you're put on some sort of blood thinner. Occasionally the clot might be extensive enough where surgeons have to go in and actually deliver some blood clot dissolving medicine directly through the vein, through like a catheter, or even do a thrombectomy where they go in and cut out the blood clot. But more commonly, you're just going to be put on blood thinners. And the reason that Wembanyama can't continue playing is because basketball is enough of a contact sport that you cannot safely compete when you're taking blood thinners because of the risk of other trauma, injuries to the head, etc. And oftentimes it's blood thinners for about 3 to 6 months, hence why he's going to be out for the rest of the season. The bigger question then is, well, why does something like this occur? And a lot of times we see it when it occurs in overhead athletes because of the repetitive overhead positions causing repetitive traction and irritation on that vein as it's coursing through what anatomically is a very nice, tight, narrow space. There's a lot of stuff that takes place up through here. You're going to have the scalene muscles. The scalene muscle is going to come down, and that can cause some compression from the underside up onto the subclavian vein. Sometimes the first rib can be playing a role, where the first rib is again causing some tight compression in this whole area we call the thoracic outlet. If you remember Markelle Fultz thoracic outlet syndrome, again, damage to nerves, blood vessels in this thoracic outlet for various reasons. And when you have a vascular DVT, vein thrombosis, thoracic outlet syndrome, that's going to be this Paget-Schroeder's. The definitive way to treat this, oftentimes these individuals will have surgery because you're going to have the continued repetitive overhead motion playing your sport. And so they try and release or open up this thoracic outlet space. Oftentimes that involves potentially a resection or removing the first rib. Sometimes these scalene muscles can be resected. Sometimes players even have what's called a cervical rib, where there's an extra rib up top here that can be causing additional compression. So a thoracic outlet decompression surgical procedure to try and free up any compression irritation through this space is usually the definitive treatment. Now we've seen with Brandon Ingram, he's come back, he's had a great career, no issues, and I would hopefully expect the same for Victor Wembanyama. So hopefully this kind of makes things a little bit more sense here. Think of this as something that happens most often to repetitive overhead athletes. The repetitive shooting motion can cause trauma in that blood vessel, potentially some compression from nearby anatomic structures. Over time, that causes a clot to develop within that vein. The clot develops, blood can't get back from the arm up in, so you get swelling, pain. Thankfully, in his case, it doesn't sound like the clot moved or embolized into the lungs, but to treat this, you're often going to be put on blood thinners, which restricts your play, and typically undergo a surgery for decompression of this whole thoracic outlet space to remove that external compressive force on the blood vessels. That's it for the video, everybody. Let me know, as always, any questions or comments down below, and until next time, we'll see you later.